Hey, Melissa.
Okay, Courtney, take it away.
Thank you so much. Um, and good morning, everyone. Thanks for attending this session. We had the opportunity to share this work at the conference last week, but I know some people didn't have the chance to attend, or maybe some people thought it was so good that they're attending again. I don't know. So anyways, welcome and thank you so much for coming, because it's really exciting to share this work. We've been working on this for the past year, and really great to be able to share this new shared measurement approach that will help us implement the new outcome model and key performance measures identified in the FCSS accountability framework. So just so you know, there will be time for questions at the end, and you can put the questions into the chat, or I think there's also a hand raise function in Zoom that we can use at the end. So please hold your questions though till the end. And then, as Melissa said, we will be sharing the slides, and there's a handout that goes with it. So you'll get those after. The last thing I wanted to say is that the changes we're talking about today, they don't come into effect until the new grant cycle begins in 2026. So when you're thinking about your reporting for this year and next year, the 2024 and 2025 reporting will still be using the old model and the reporting approach that you're currently using. So the purpose of today is we're going to give a brief overview of where we've been and where we're going with the implementation of the accountability framework. We'll also review the provincial prevention priorities and strategies, and talk about how they align with the preventive work that FCSS does. Finally, I'll review the outcome model and the key performance measures that are identified in the framework. Then I'll turn it over to Bonnie, who will tell you about the work that Three Hive has been doing this year to develop the new shared measurement approach that will allow us to implement this outcome model and collect reporting based on the key performance measures. Then finally, we'll wrap it up by telling you about next steps and what you can expect to see over the next several months. So I wanted to start by giving some background on the accountability framework and where we've been and where we're going in terms of implementation. I know some of you have probably heard this before, but I think it's important. It might be new to some people, and it really helps to explain how the framework came about and helps to explain why we're making some of these changes. So in 2021, Cabinet directed the development of an FCSS accountability framework. And their direction came out of the FCSS program review that was completed in fall 2020. The program review included extensive stakeholder engagement and cross-ministry consultation. The review identified the need for an accountability framework that defined prevention and that clearly identified the preventive focus of the FCSS program. We developed the framework throughout 2021 and 2022 in partnership with the FCSS AA and a steering committee. The framework builds on the strength of the FCSS program and helps to provide clarity on the value of prevention and how FCSS programs are having an impact on the lives of Albertans. Key elements of the framework include a common definition of prevention with a focus on strengthening protective factors, direction on provincial prevention priorities and prevention strategies that are used to address the priorities, a clear governance structure with roles and responsibilities for the province and participating municipalities and Métis settlements, and a streamlined outcome model and key performance measures to demonstrate the impact and value of FCSS in supporting prevention, and that's what we're talking more about today. The framework came into effect in January 2023, and in early 2023, we set up sessions with the Directors Network and some of our cross-ministry partners like Children and Family Services and Mental Health and Addiction and Seniors. These sessions helped our cross-ministry partners learn more about what FCSS does in the community, and it also gave them an opportunity to share information about the work their ministries are doing. And it was really important we did this because we know that the preventive programs and services offered through FCSS intersect with programs and services offered by many other ministries. In March this year, we turned to the final step of implementing the framework, which is this project that we're telling you about. developing a new shared measurement approach that will allow us to implement the new outcome model and key performance measures in the next grant cycle. Before we get into more detail about the new approach, I also wanted to go over some key elements of the framework in a bit more detail, because doing this can help us see the connection between the definition of prevention, the prevention priorities and strategies, and the outcome model and key performance measures. So starting with the definition of prevention, the framework defines prevention as a proactive process that strengthens the protective factors of individuals, families, and communities to promote well-being, reduce vulnerability, enhance quality of life, and empower them to meet the challenges of life. And just to go over a couple of these definitions, we know that protective factors, those are conditions or attributes that can help to mitigate or eliminate risk, leading to improved well-being. And I won't go into too much detail about this. I think most people are familiar, but I did want to do a bit of a quick review. So prevention, as you know, it falls along a continuum, and the services and supports offered through FCSS must focus on primary and secondary prevention. This is really an important element to the framework because it, again, helps to keep FCSS focused on prevention rather than intervention. The framework also identifies provincial prevention priorities and strategies. And it's important to understand how these align with prevention and the preventive focus of the FCSS program. The prevention priorities are intended to reflect the key social issues facing the province. The current priorities are homelessness and housing insecurity, mental health and addiction, employment, family and sexual violence, and aging well in community. Taking these priorities and the definition of prevention together, we can see that FCSS is intended to build protective factors and to help people have positive outcomes or reduce risk factors in relation to these social issues. Through the programs and services they offer, FCSS can address the root causes of these social issues, provide supports that address issues at early stages, or connect those in need with appropriate resources before situations reach a crisis and require more intensive supports. The other thing to keep in mind is that while the programs and services offered by FCSS are intended to support these priorities, the connection might not always be a straight line. Prevention programs, like especially primary prevention, like childhood development programs and parenting programs, these are really upstream of the prevention priorities. Many prevention programs can address the root causes of more than one social issue. Just as an example, we know that mentoring programs, after-school programs, and social emotional learning programs can help children to develop protective factors that can offset multiple risk factors, such as challenging families, language or cultural barriers, and living in chronic low-income environments. We know these risk factors can lead to challenges later in life. So that's not to say that because someone grows up in a challenging family or because they have language or cultural barriers that they will become homeless or will have mental health and addiction issues. But we just can say we know these things are risk factors. Another example is programs that help people to develop social connections. So whether it's a question of parenting or immigrant integration or aging well in retirement, we know from research that people with extensive social connections, linking them to people with diverse resources, tend to have more employment, be happier and healthier. On the other hand, when people are lacking in connections, they're at higher risk. So thinking of isolated seniors, for example, while we can't say for sure that by attending seniors programming, someone wouldn't have to go into long-term care, we can say that social isolation is a factor that could lead someone to need to move out of their home to a place where they can get more intensive supports. So this is where the prevention strategies come in now, because they really help us to define how FCSS programs and services do help to address these priorities. The prevention strategies are intended to show at a high level the things FCSS can do that can help to enhance protective factors for individuals, families, and communities. So these are activities that promote and encourage active engagement in the community, foster a sense of belonging, promote social inclusion, develop and maintain healthy relationships, enhance access to social supports, and develop and strengthen skills that build resilience. So identifying these strategies further helps to define the kinds of things that FCSS programs and services provide to help people have positive outcomes or reduce the risk factors in relation to the social issues. So really, these strategies reiterate the part of the regulation that identifies the service requirements. The regulation tells us what services provided under a program must do, and you can see the connection between the strategies and the regulation. And we know these are the programs and services that FCSS really has a long history of providing in the community. That is programming that is intended to enhance protective factors for individuals, families, and communities, based, of course, on local needs. And by using these strategies, FCSS programs and services help to promote well-being and build stronger and more resilient communities. So moving on to the outcome model and the key performance measures, the outcome model helps to establish a common understanding of what the FCSS program is intended to achieve. The key performance measures are indicators of progress, and they help us to demonstrate the impact of the program is having at the provincial level and help us to tell the FCSS story. So some of you may be familiar with the old outcome model, and this is the one we're still currently using, which was developed in the early 2010s. It identifies 7 program outcomes based on improved social well-being in individuals, families, and communities. The old model also identified indicators that help us to determine whether the program is helping to achieve the intended outcomes. Looking at these indicators, and I know it's a little bit hard to read on the slide, but you can see they include things like resilience, social relationships, social network, access to resources. And these are really those protective factors that we talked about, conditions or attributes that help to mitigate or eliminate risk leading to improved well-being. Comparing the old model to the new model, we can see the new model identifies 5 objectives and related outcomes. So unlike the old model that only showed the outcome, the new model identifies both the objective or the goal of the program and the outcome, what we would expect to happen when we achieve the goal. As you can see, it still includes those individual, family, and community outcomes in the first objective, which is that FCSS programming enhances the protective factors of individuals, families, and communities related to the provincial prevention priorities. And the outcome, what it's intended to result in, is Albertans having protective factors in place that enhance their resilience. The model also includes 4 other objectives and related long-term outcomes, which are that FCSS programming strategically connects Albertans to address provincial prevention priorities, which is intended to result in FCSS programming contributing to improvement in community-level indicators, reflects community demographic and need, which is intended to result in local demographic and need being addressed through the FCSS programming, is accessible, appropriate, and designed to serve Albertans across their lifespan, which is intended to result in FCSS programming being accessible, appropriate to the populations being served, and fosters connectivity in participating communities, which is intended to result in Albertans being supported by networks within their communities. So now that we've gone through these, you can see the outcome model, the updated outcome model, still reflects what the FCSS program has always aimed to achieve. Now, we know if we set objectives and outcomes, we need a way to identify if we're making progress, which brings us to the key performance measures. You can use them along with other local information to describe the impact of your program at the local level and to evaluate how well the program is working. Historically, FCSS has used the outcome measures in the measures bank to demonstrate the impact and to evaluate the effectiveness of the program. And I'm sure most of you know, the measures bank is a really long list of survey-based questions that FCSS programs can use to show that by participating in programming, individuals experience positive change. And while these questions are an excellent tool to help determine how well a program is working and whether it's helping to develop protective factors, the number of them makes it difficult to roll up at the provincial level. And Bonnie's going to tell us a lot more about the work they did with the Measures Bank during her part of the presentation. We also know that the Measures Bank and those outcome, those survey questions, they're not always appropriate for all the programs and services that a local FCSS program may offer. The key performance measures are a set of 13 indicators that demonstrate progress toward intended outcomes. But unlike the measures bank, they include outputs, some program level survey data, and some publicly available data sources. You also know that when you report on a program or service you provided, you have to provide a narrative program description. And Bonnie is also going to tell us a lot more about this, but local FCSS programs have different approaches to describing their programming. And so this makes it difficult at the provincial level to describe the programs and services you provide and link them to the overall impact of the program. The key performance measures allow us to establish some standardized and streamlined ways of describing FCSS programs and services at the provincial level. And they really do help us demonstrate what FCSS programs are doing and the impact and value we all know that FCSS programs have. We'll collect the key performance measures using the annual reports. While the KPMs are provincial level indicators, they can also be meaningful and relevant at the local level. That said, they're not intended to change or replace any of the evaluation activities you're currently doing. The data you collect and analyze at the local level to help you determine how well your program is working and whether it's meeting the needs of the community will necessarily be more detailed and have much more of a local focus. There may be specific outcome indicators that even if not included in these key performance measures, you might want to include because use at the local level because they help you tell the FCSS story in a way that's most meaningful in your community. So I'm going to turn it over to Bonnie, and she's going to introduce you to key elements of our new shared measurement approach. And I want you to know this is really just the start. This is intended to be an introduction and a high-level overview. We know that you need more details and we'll be providing information and training throughout 2025. We also know it's important that you get the right information at the right time. One of the reasons we're rolling this out now, even though it doesn't come into effect until 2026, is because we know many of you provide grant funding to other organizations and you'll need time to communicate the changes and update grant agreements with the agencies you fund so they're ready for 2026. We also know you plan your programming and evaluation activities well in advance. So even though 2026 is more than a year away, we know you need to start planning now. So I'm going to turn it over to Bonnie.
Thank you, Courtney. Good morning, everybody. It is a pleasure to be here and to describe this shared measurement project we've been working on for the last year. I'll just do a quick introduction because I think many of you don't know me. So I am Bonnie Lacusta. I am an evaluator by profession. I work for a small consulting business based out of Edmonton called Three Hive Consulting. So what we do is we help not-for-profits or healthcare organizations design measurement systems, implement those measurement systems, and report on the impact they have. So it's been really great getting to know the FCSS program and working with the ministry over the last year. So this is my agenda, and we'll just use it to stay oriented throughout our discussion today. So I'll start then with a quick overview of what we were brought in to help with and how we went about doing that. So the association actually asked for some help in developing and implementing a shared measurement system to enable municipalities and Métis settlements in the FCSS program to measure and report on programming and outcomes. Quite a mouthful there. Essentially, we are building the shared measurement system to align to your new outcome model and your new accountability framework. It was important for us to make sure that all of our exploration and learning and all of our proposed changes were grounded in the FCSS experience and came with feedback and input from you, from the FCSS programs. So we had this bi-weekly advisory group that met over the last year and was comprised of 4 of your peer directors, a Métis settlement program liaison, members of the association, and members of the ministry. When we got started, one of the first things we needed to do was a current state analysis. We needed to understand what was happening currently, how were you measuring currently, and what was working well, and where maybe there was some opportunity for change. We also conducted a jurisdictional scan so we could learn from other organizations with shared measurement systems, so we don't have to reinvent the wheel. What lessons learned can we capture? What successes or enablers did they implement that we can kind of steal from? We also took a close look at your measures bank, knowing that that was an important part of the measurement you do currently. We also looked at the data you submitted to the ministry over the last 2 years, so we could understand what types of things you were reporting on, and also what that's like on the receiving end of that data for the ministry to be able to aggregate that information. So then we set out to address that statement that I read to you, and we started out with some definitions. And Courtney described to you that one of the big changes in the accountability is you have now a definition of prevention, and we wanted to build on that and really offer some clarity and standardization to some other key terms. We are also developing a reporting guide for you, so you will have lots of additional guidance and training that will help you to implement this new measurement system with as much ease and reduced burden as possible. So today then I will share with you the highlights of what we learned, where we are currently, and what you need to know for 2026. So like I mentioned, we did the current state analysis, and we needed to hear from you what things were working or what things you didn't like. So we sent out some surveys, and do know that if you responded to any of the surveys that we've sent out over the last year, your input absolutely impacted where we are today and was definitely factored in. Once we had results from surveys, we did a bit of a deeper dive with some interviews and focus groups so we could really understand the context and the experience of running FCSS programs. Okay, so that was my overview and how we planned the work. Let's take a closer look then at what we heard from that current state analysis. The good news is that we heard that a lot of things are working well. We heard that your annual reporting IT system is user-friendly and intuitive, so please don't change that, right? That's good for us to know. We heard that what you were being asked to report on was manageable, right? So reading between the lines there, the ask was, please don't pile on or make it unmanageable for us. We heard that the data you're reporting in your annual reports is also helpful at evaluating your local FCSS programs. And so where we can retain that benefit and retain that double duty of any measures that you're reporting is an important consideration. We also heard that the resources you had available to you to support you in your annual reporting were helpful. So a lot of things were working well, and wherever we could, we tried not to fix what wasn't broken. However, of course, the flip side of that is we did hear some opportunity for improvement. So we did hear that terms needed defining, and I talked about how we did that right from the get-go, looking for some clarity in definitions. We heard that your measures bank is large and overwhelming and difficult to use, and that there was some work to be done there about simplifying your measures bank. We heard that you don't feel like you have an opportunity to give a full representation of the work that you do related to impact. So a lot of you described this as like the big picture. You felt like you were reporting a lot of numbers and outputs, but you weren't really given an opportunity to share your success stories or those impacts that we heard a lot about when we connected with you. You also told us it was difficult to capture community relationship building and partnerships. We heard that you're not clear on how the ministry uses data, and we heard a lot of assumptions about what may be done with the data. So any clarity that could be offered there would be helpful to you. And while you did say that supports were useful, you did express the desire for more, right? More is better sometime, and any additional support would be wanted. So we set out to address as much as we could in our new shared measurement approach, but it can't all be addressed at once. It is a process of continuous improvement. Okay, so let's talk about one of the things that will be different in your 2026 reporting, and this is the idea of service categories. So let me explain what this means. In your reporting, starting in 2026, you will be asked to categorize the programs and services you offer into one of 4 main categories that you see on the slide here. This categorization will replace that program description field in your current annual reporting that Courtney mentioned in her presentation. So when we looked at the data you'd submitted over the last 2 years and looked at that program description field, we found that it was being used quite variably between all of you FCSS programs across the province. Some of it, you were using it to describe in detail the activities of that program. Some of you were using it to describe the outcomes of the program. Some even used it for demographics or as an opportunity to share those impact stories that you didn't have another place to put. We also heard it was a bit of a stressful experience for some of you where you pained over wordsmithing this field and using it as an opportunity to really let the ministry know everything that you would like to share that you couldn't capture anywhere else. So now, by asking for programs to be categorized, we are hoping this streamlines the way that you describe your programs so they can be reported on at an impact level at the municipal level, the regional level, and the provincial level. So it will standardize the data so it's more usable for the ministry. And we also hope that by offering this categorization, you're not stressing over that program description field and wondering what you can put in there that describes all the wonderful work you're doing. So we hope it also is a bit time saving for you in your reporting. So of course, we've been talking a lot about definitions, and each of these program categories does have its own definition. What you see on the slide today are just kind of highlights from those descriptions. So I'll go through them quickly here. Programs are usually something that a participant would register for, but also include drop-in programs or system navigation services. You might describe the people that take part in these programs as participants, as opposed to information and referrals, which is usually a one-time interaction, probably without any registration required. And you may describe people who participate there as service recipients. Now, I'm using the word usually quite a bit here because I do recognize that people can come up for follow-up referrals, or an individual may come for multiple referrals over the course of a year. So, but it is usually a one-time interaction. And then we have community events, which are also usually a one-time event. They are often tied to seasons, holidays, or some sort of celebration. They may or may not require advanced registration, and you may describe the people who participate as attendees, right? They're attending your event. So when we think of those three categories collectively, you may notice that the intended beneficiary is the Albertan or the community member in whom you are attempting to build protective factors, which is different than the final category of community development and capacity building. So this is a wide range of activities funded by FCSS that is not directly aimed at that individual support. This is your evaluation. This is your needs assessment. This is your partnership building, community work, sitting on boards or committees. And this is training volunteers as well. So instead of having the Albertan as your participant, service recipient, or attendee, likely your capacity building and community development activities involve FCSS staff or involve your volunteers. Okay, I'm not intending to overwhelm you with this slide, but I just wanted to highlight for you that in addition to the 4 program categories, some of them will have types or subtypes that further allow the ministry to standardize and describe your activities. We did a lot of analysis and a lot of back and forth with our advisory group and with the ministry team to make sure that we were coming up with the best depiction that we could. We did send a survey out to directors several months ago, so looking for confirmation that we were on the right track and looking for anything that you could share with us where we've missed an opportunity. So again, know that if you responded to those feedbacks, you're responded to those surveys, your feedback was taken into account and did shape the model that you see on the slide today. So as you can see, the types and subtypes mainly apply to the program category and less complex for the other 3 categories. Let me also say here that we know this model isn't perfect, and it probably never will be. For sure, there are going to be programs that you may want to slot into more than one category, and there are probably going to be programs that you find difficult to fit into any one of them. The goal here is not perfection. The goal is to get a best representation of what you do. Now, remember, I talked about a reporting guide. So we do have lots and lots and lots of examples for you. We have resources, we have instructions. There's lots of additional training for you to support you in doing this categorization activity and making it as simple as possible. So while I'm talking about programs, I wanted to talk about participants and counting participants in your annual report. So again, we have a definition for participants. It's actually not on the slide in its entirety because it differs for each of those new program categories. And you probably got a hint of that when I described the participants as being attendees or service recipients. So slightly different descriptions for each of those program categories. What you do need to know is that in your annual reporting for 2026, you will be asked to report on the number of participants for programs and for community events. You will not be asked to report participants in community development and capacity building. Remember, that is not about the Albertan or community member. That is likely FCSS staff and volunteers, which we'll talk about later. And information and referrals, we will get to, you will report on that differently than you currently do. Also, you will not be asked to report unique participants. So we had a lot of discussion again with the advisory group, with the ministry and association, but we understand the impact of FCSS programs should be counted in the services you offer, the number of engagements or touch points, but not the number of unique individuals. So if this is something you currently track and it continues to hold value for you at the local level, you can certainly continue to track it, but it will not be a requirement for your 2026 reporting. Still talking about programs here, I wanted to touch on demographic and community group reporting. Again, this is something you currently do. When we looked at the data that had been submitted over the last couple of years, we saw that it was quite difficult for the ministry to aggregate the data or summarize it in a way that made sense. And it's not your fault in the way you reported. There was actually some issues with the way the question was worded. So we've made some slight changes there, but nothing that should change the way that you collect data or report. One key difference, though, is in the instruction that you will see, and you'll see this language about intended primary audience. So that is that your reporting should report on who you are specifically intending to enhance protective factors for. So while your program may have participants across several age groups or several community groups, you will be asked to report on a target audience in whom you intend to build or enhance protective factors. Now, if that target audience is the community at large or the broader population, that's fabulous. You can absolutely report that you're not targeting any one group, and that's important for the ministry to know as well. Okay, so that was a new addition, program categorization for 2026. Let's talk about another change that Courtney described. And this is about drawing alignment between the services you offer and provincial prevention priorities and prevention strategies. So again, we'll start with a definition. So you will have access to a glossary with all of these definitions available to you. Just like Courtney said, prevention strategies are ways that you enhance your protective factors. So there are 6 prevention strategies. While the outcomes related to the strategies are explicitly reported in one of the key performance measures, which I'll show you on the next slide, these strategies apply to everything that you do. This is how you offer your programs and services. This is how you build protection in the community. So when it comes to reporting, outcomes related to these 6 prevention strategies will be reported in one of the key performance measures as positive change. So again, positive change is one of those terms. We've got a definition for you. So if you're curious about what that means, lots more resources and help are coming. We also have lots of examples and guidance on how to report positive change. And it involves surveying. So I'll just move to the next slide here. Each prevention strategy, so each of the 6, will have a series of survey questions available to support your measurement of positive change. There'll be lots of examples on how to choose survey questions and how to apply that surveying. Your programs may align with one of the 6 prevention strategies or multiple, and that is okay. That's great. So just a really quick example for you here. If your FCSS program runs a short-term counseling service, you may consider that the strategy employed is to build resiliency. So looking at the 6 prevention strategies, you would decide that develop and strengthening skills that build resilience is the best aligned prevention strategy. And then we have provincial prevention priorities. Again, we have another definition for you here, just like Courtney described. These are key social issues affecting Albertans, and there are 5 of them outlined in your new accountability framework. Again, prevention priorities are addressed in everything that you do. FCSS programs exist for this preventative nature to prevent these social issues. But specifically in your reporting, they are related to 2 key performance measures, which ask you to report the number of programs that align to each priority and the amount of funding that aligns to each priority. So you will be asked to identify which prevention priorities your programs align with. Now, this may seem like a bit of a daunting task, but I do believe that you think about your programs in this lens already. A key difference is that you may be thinking of the actual activities of your program, or you may be thinking about what your programs are building, creating, or developing in the short term. And these priorities actually ask you to think about that long-term vision or that ultimate outcome and identify what social issues you are preventing. So you may need to look to some guiding documents that you have, if you have vision statements, purpose statements, logic models, or theories of change, any long-term outcomes. These may be your guiding light in helping you identify which provincial prevention priorities your program's aligned to. So it's about thinking of that pathway and how you are addressing prevention. So I sound like a bit of a broken record here, but you will have more detail in your reporting guide, and this will be addressed in more detail in your training as well. Another quick example for you here then, if you run a family conflict mediation program, you may consider that the goals of that program are to build skills in family members so that they can engage in nonviolent conflict. Thus, when you look at the 5 provincial prevention priorities, you may choose that family and sexual violence across the lifespan is the best alignment. Okay, we have just waded through some very complex territory. You may be feeling a little bit nervous or that a lot of things are changing, and I don't blame you. So let me spend the next good chunk of time just describing small changes or small improvements to things that you are already familiar with. And we will start with the idea of surveying. So surveying is not going away. You will still have a new measures bank, although it may have a new title. So Courtney shared with you that there are 13 key performance measures in your accountability framework. 3 of them will be reported using survey questions. And so we needed to design those survey questions and come up with that alignment. So to start with, we looked at your measures bank. We wanted to know what you already use, what is already familiar to you. We also looked to any FCSS programs that have websites with publicly available evaluation approaches or any additional survey questions that you know that you've tested and proven work. We used AI to help us out, just cover all of our bases, make sure we weren't missing any key concepts, and of course, we did some literature and research as well. Before I get into the details of the survey questions, just wanted to take a tiny detour and share some what I thought were fun facts. Now, I'm a bit of a numbers geek, so I always think numbers are fun. But we looked at your measures bank. I've said that a couple of times now. Your measures bank had 617 survey questions available to you. That is a ton. That is a lot of survey questions. So no wonder that you were reporting to us that it was a bit overwhelming, that it was difficult to navigate, that it was a complex bank. But interestingly, when we looked at the data you submitted over the last 2 years, we learned that only 330 survey questions were reported. So that's really interesting. You're telling us right away that nearly half of the survey questions either didn't apply, weren't a great fit, or weren't useful to you. Even more interestingly, of all the survey questions reported to the ministry over the last 2 years, 50% of them came from the same 30 questions. So this is fantastic for someone designing a measurement system. You are telling us very clearly that these 30 questions are relevant to your programs. They're good for your participants to answer. They're meaningful for you at the local level. And so we definitely took a look at those 30 questions. And what we were able to do is get your measures bank down to 50. So your new survey questions could be comprised of 50 different statements you can choose from instead of 617. So just a quick details about where they came from. So like I said, we looked at those top 30 in your measures bank quite closely. If you look at the darker blue box on the top left, 13 of those 50 questions come from those top 30. So I hope that many of you will find that the questions you're already using appear again in the new measures bank, and you can just carry on using them. 13 additional survey questions, the pale blue box at the bottom, also came from your measures bank, but didn't come from the top 30. So you may be asking why we couldn't have just taken all top 30 if we know that you use them. It's because you have a new accountability framework. It's because you have a new outcome model. And while Courtney did show you alignment between the old model and the new model, there are some slight changes, and we really needed to focus on that alignment and make sure that the new measurement system was meeting the measurement needs of your new outcome model. So that means just over 50% of your new survey questions should be somewhat familiar to you. They came from your measures bank, which means the other 24 came to us from AI, from our research, or from other FCSS programs. So of course, if you are using survey questions from the old Measures Bank that are still meaningful to you, and maybe they didn't make the cut here, maybe they don't show up in the new Measures Bank, you can still use them. You can absolutely use any other survey questions you want to use. You just wouldn't be reporting on those, and you would need to include a new survey question or survey statement so that you can report back to the ministry. Okay, this is another slide that I'm not meaning to overwhelm you with or confuse you with. I just wanted to quickly draw the alignment of where these survey questions are fitting into the accountability framework. So just like Courtney described, your new accountability framework outlines 5 key objectives for each FCSS program. Each of the 5 objectives is connected to a series of short, medium, and long-term outcomes. They are not actually represented in detail on the slide, but there's a little arrow with the word outcomes in it. 2 of those objectives are listed here because they align to 3 of the key performance measures that will be measured using surveys. You will select your survey questions, align them to the prevention strategies, and report them in your annual reporting. Now, I know you're interested in seeing what the survey questions look like, and you may already have seen them if you were at the conference and happened to pick up this handout. Like Melissa mentioned at the start, you will get a copy of this, so this will either be emailed out to you or made available to you somewhere. But this is a zoomed out view of what the new Measures Bank looks like, and I just wanted to alert your attention to a couple of key changes. So one, it's in Word format, not Excel. So one of the things that I found so interesting in speaking with many of you about your programs over the last year is, a lot of you do indirect service delivery and you have to work with community or partner organizations, and you like to print things out or customize things or copy and paste different things to put together your own handbook. And so we just thought that a Word format might be easier for you to navigate and use than in Excel. The structure of the new Measures Bank here is that each of the 3 KPMs that I've been talking about has its own section. Each KPM will have somewhere between 3 and 10 survey questions that you can choose from. And of course, that first key performance measure, which is about the prevention strategies, each of the 6 prevention strategies has its own section. So you can just once you've chosen your strategy, you can navigate to that section. You don't have to pay attention to all the other survey questions that would be less relevant to you. So a bit more of a zoomed in view here to show you what it might look like. So this is an example of the first key performance measure, which aligns to the 6 prevention strategies. You can see the prevention strategy at the top in blue. And then we have this yellow box. And again, we had a little bit of a discussion around whether or not to include this box because we're not meaning to confuse you. We call it program intent, but it is not something you need to report on. It is not something you would need to select. It is meant to be guidance and additional support for you in selecting your survey questions. So as you can see, the prevention strategies are quite broad conceptually and actually cover quite a few different topics or concepts. And so the yellow boxes are attempting to tease out those concepts so you can go to those specific survey questions. If, however, they are adding confusion, you can absolutely ignore them because absolutely any of the survey questions are available for you to choose. Then, just like your current Measures Bank, we have the post-only version and the pre-post version of the survey statement. They are the same statement, just worded differently depending on how you implement your surveys. And then we have added unique numbers to each question. This is actually one of my favorite changes in your new measurement approach, just to give you a dialogue and a language if you're talking with any community partners, if you're talking with other FCSS programs, that you can talk about which survey questions you're using a little bit more easy. Okay, I've spent quite a bit of time focusing on just 3 key performance measures, but Courtney told you there were 13. So I just wanted to touch lightly on the other 10. The other 10 are not survey-based. They are output-based. So many of them will be reported as counts or numbers. Some of these we will get to. We'll talk about information referrals. We'll talk about volunteers. We've already talked about counting participants. So the other 10 KPMs are not survey-based, but output-based. Okay, so let's talk about information and referrals. Many, if not most of you, offer this as part of your services, but we've been told it's difficult for you to report on. It can be tedious or cumbersome for you to do. So we've made a couple of small changes here that will be optional for you. So let's start on the left hand. side of this slide where it says record every transaction. This is your status quo. This is what you currently do. So many of you use a spreadsheet or a tally sheet to keep track of all the referrals that you make. We did hear that some of you may actually have your own software that helps you track referrals, and that's fantastic. If these processes work for you, then there is no change. You can continue to use these processes. If, however, tracking every single referral on a manual tally sheet is too tedious, perhaps you don't have the capacity or resources to do it, or perhaps you lack the confidence that it's being done effectively, we are introducing an option for you to sample. So I'm sure you all know what sampling means. I guess it is technically a statistical term. It simply means you will track some referrals over the year, and you will make an estimation for your total number of referrals over the year. So it likely involves choosing certain days of the week to measure, certain weeks of the month, or maybe certain months of the year. Again, we've got additional resources and support for you. So there are lots of examples about how to choose a sampling method, how to implement that sampling method, and also how to check to make sure that you are reporting with accuracy and that it is accurate and representative sample so that you can make that estimation over the year confidently. Okay, let's talk quickly about counting volunteers. Again, we've got definitions for you because we heard there was some clarity concern here. So essentially, we saw two options about how you report volunteers. One is that you report a single number over the course of the entire year over all of the programs and services that you offer. The other option would be that you report the number of volunteers per program that you offer. We did send this out in a survey to you. Again, thanks to everybody who participated in our surveys. You definitely guided our approach here. You can see there was a slight skew to people wanting to present the total number over the course of a year, which is our approach and is the recommendation. And that's for a couple of reasons. One, it's the current way you do things, so it's actually no change for you here. Two, we heard that some programs don't track volunteers at the program level. And so it would be impossible for them to do that if asked. However, those of you that do track volunteers at the program level, you should be able to sum that number to get a total over the year. And finally, we heard that many of you actually just estimate your volunteers over the year. And we know statistically that if we ask you to make an estimation several times over each of your programs, it's likely to be an inflated number versus just asking you to make that one estimation. Okay, and the last change I want to share with you is something I hope you'll be excited about, something we heard many of you asking for. So you did hear me say earlier that the program categories are replacing your program description field, despite the fact that many of you told us that's the only place you can share all your impacts and all your fantastic success stories. We are also replacing the program description field with your ability to report some qualitative findings. So you will have an optional opportunity to provide an impact narrative, to talk about your achievements, to talk about your contributions. So it will be optional, but not only will you have one opportunity to do this, you will actually have four. So they will be aligned to those new program categories. So for each one of those sections, programs, community events, information and referrals, community development, capacity building, you can share a success story. Again, we have lots of tips for you. We have examples on how to do this. Importantly, we also need to think about what it's like to be on the receiving end of these qualitative fields. And that was one of the troubles with the way the program description field was currently set up. It was really difficult for the ministry to use that information in any meaningful way. So there will be word count limits on your impact statements. There will be guidance about how you can be concise and clear and really specific so that the ministry can use them. We also hope this will align nicely with the work the association is doing on helping you report impact. Okay, I'm getting very close to the end here. I just wanted to touch briefly on evaluating your own programs. So I hope that none of what I've described will prevent you from evaluating your own programs. You can and should still be doing that. Like I mentioned before, you can use survey questions from your new measures bank, from the old measures bank, or really any survey questions that you think will help you evaluate your own programs. You can use the survey, but if you want to supplement with focus groups or interviews or observation or absolutely any other method that helps you better understand at your own local programming level how you're doing, absolutely please do those things. You told us that the things you were being asked to report currently were helpful to you at the local level in your evaluation, and we hope that is still true. We expect it to still be true. So I just wanted to say, hopefully that alignment and benefit still exists. So that's it. Let me just summarize for you quickly, and I will pass it back to Courtney. So to highlight what's new, program categories are new. You will be asked to identify what types of services you are offering so that the ministry can have a standardized representation of activities conducted across the province. But you also have an easier to navigate measures bank, cutting down from 617 questions to 50. You will be asked to draw alignment between the services and activities you offer at the program level to the provincial prevention priorities and prevention strategies. Referral interactions, pardon me, are now counted separately from participants, and you now have the option to sample or estimate your referrals over the year. And finally, you will have an opportunity in your annual reporting to report impacts, to report those stories and successes that are so meaningful to you and so meaningful to the province, and that we heard a lot of when we connected with you over the last year. So you don't need to remember all of this. Like Melissa said, this will be recorded and available to you to share with your team members or colleagues. The ministry will be providing you with training over the coming year to get more into the detail about how you do all of these things. And you will have a reporting guide full of examples. I love learning by example. I hope that many of you do too, and we'll have step-by-step instructions and lots of definitions available to you. So with that, I will pass it back to Courtney.
Thanks so much, Bonnie. So as we wrap up, here are the things I'm really hoping you'll keep in mind as we work together next year to get ready for this new approach. First, the new approach and the identification of priorities and strategies, these don't change the preventive focus or the local focus of the FCSS program. They help us to provide clarity about what prevention programming is and how it helps to address the key social issues facing the province. The overall outcome of this work is we will be better able to demonstrate the value of prevention and the impact that FCSS has across the province. It will provide us with a more consistent, standardized reporting method that will allow us to demonstrate the great work that FCSS does at the provincial level. We'll be able to roll up the data and share it with you. One of the questions we hear, and Bonnie mentioned this, is what does the ministry do with this data and what are they going to do with these key performance measures? Our goal in the long term is that once we can collect them, we'll be able to develop an annual report that compiles the data at the provincial level, and we'll be able to share it with you, and you can share it with your boards and councils and add in your own local data. So throughout 2025, we'll be providing information and training sessions to make sure you have the information you need. And this is really a high level overview of what we've got planned. But we're going to learn from each other as we go. And I really think this will evolve over time. And we want to take a really agile approach to this training. And I think that really reflects the work that we did with Three Hive over the past year or two, is really getting feedback from local programs and working with Directors Network and the FCSSAA to make sure that we're responsive and hearing feedback and being responsive to it and listening to the local needs. We'll make sure there's an opportunity, as I say, to provide feedback so that we're doing the best we can to provide the information in a way that works for you. If we need to add sessions on a specific topic as we learn more about what type of support you think would be helpful, we'll try and do that at the right time. This training and the information that we're sharing will continue into 2026, and we'll continue to work collaboratively to make sure things are coming out at the appropriate time. The sessions will be virtual, which will allow us to offer them, first of all, more than once, and also to record them. And I'm also hoping that we will be able to present at Directors Network in the spring for an in-person session. As always, we'll stay connected with the association and the Directors Network so that there's more than one way that the information is shared. I know sometimes the FCSSAA or Directors Network hear about new staff before we do. So we'll make sure that this information about the sessions gets out in more than one way. So I just really want to give a shout out to all the working group members. We had Judy Smith from Edmonton and Robbie White from Calgary, Zach Morrison from Barron's, Eureka Warner, and Bobby Joe from Red Deer. We had Lynn, our Métis Settlement Program Liaison, and Melissa and Colleen from the association, and then Bonnie and her team. It was really a group effort, and I'm just so grateful for everyone's time. So thanks for taking the time, and we'll open it up for questions. I see one question in the chat that says, for clarity, we will be gathering this information under the new reporting framework over 2026, and it'll be first inputted in the report due April 30th, 2027. And yes, that's correct. So you don't start collecting data this way until 2026. I don't see other questions. So, I mean, you know, always reach out to me. I think most people know how to get in touch with me or the association or your Directors Network member. So I don't know, Bonnie, I don't think we have anything else. So thank you so much. And take care, everyone. Oh, Melissa, you're there. Sorry.
Yeah, I can't believe there aren't any more questions. You guys are amazing. Thanks for doing such a comprehensive job on this. And once again, we will send out the recording, the handout, the slides, and I have been told that they are also on our website already, the handout and the slides, but we will send them in an email out to all the programs. Thank you, everyone. Have a good afternoon.
Thank you.